of menstrual cycle disorder. So what are menstrual problems? Menstrual problem. At one extreme, hello everyone, welcome to another episode of How to Get Pregnant and Have a Baby. My name is Dr. Babatunde Kewale. I am the MD/CEO of St. Ives Healthcare Organization. I am an obstetrician and gynecologist. I'm also a fertility expert. Today, we will be talking about menstrual problems. Now, what is a menstruation, or what is a period? When people say they have a period, quickly I will explain how a period comes about. At the base of the brain, there is an organ called the pituitary gland. Its function is to produce three hormones: FSH, LH, and prolactin. And every month, the whole purpose of menstruation is to allow the woman to get pregnant. So what these hormones does is they operate on the ovary and make the ovary ovulate. Once the ovary ovulates in the mid-cycle, the ovary produces another two hormones called estrogen and progesterone. If the ovulated egg results in pregnancy, those two hormones will maintain the pregnancy. If nothing happens, that is, if pregnancy does not occur, those two hormones will act on the inside of the womb and make the blood flow. They will make the endometrium to shed. So that's how menstruation or menstrual cycle is done. So what are menstrual problems? There are basically 5 menstrual problems. At one extreme is what we call amenorrhea. Amenorrhea means absent period. At the other extreme is what we call menorrhagia. Menorrhagia means excessive bleeding. So that's 2. Then we have in between what we call oligomenorrhea. Oligomenorrhea means infrequent period. There are some women that don't see their period from any time between 6 weeks and 6 months. The other menstrual problems that a woman could encounter include things like dysmenorrhea. Dysmenorrhea means painful period. And then finally we have what we call premenstrual syndrome. I'll quickly expatiate a little bit more on each of these different types of menstrual problems. In amenorrhea, before you can say a woman is amenorrheic, that is, her period is absent, the process must have happened for at least 6 months consecutively for someone who has been having irregular period before. Amenorrhea can be divided into 2 types. We have what we call primary amenorrhea. Primary means menstruation has never occurred. We make this kind of diagnosis in a young girl who is 16 years old and has not seen her period yet. The term primary amenorrhea is attached to such girls. In a girl who is 14 years old and who doesn't have all the pubertal signs like breast formation and also hasn't had a period, can also be classified as having primary amenorrhea. In secondary amenorrhea, what it means is the woman has been having a period before, but suddenly, for the past 6 months, she has not seen a period. So what could cause it? The commonest cause of secondary amenorrhea is pregnancy. So it's always important, anytime a woman comes to you and says she has not seen her period, to do a pregnancy test. The other things that will cause amenorrhea are things like Polycystic Ovarian Syndrome. Polycystic ovarian syndrome occurs in about 10% of women and is one of the commonest causes of female infertility. What happens in polycystic ovary is the male hormone on the ovary is excessively high, and what that does is it blocks ovulation. And once ovulation is blocked, menstruation is also blocked. Other causes of amenorrhea could include things like obesity. If your body mass index is far above 30, it could cause amenorrhea. Being too thin, that is anorexic, or doing vigorous exercises like gymnastics normally do, could also result in amenorrhea. That is, if your body mass index is less than 18, that will result in amenorrhea. Other things are things like excessive stress. I'm sure some of us have been told stories about women who are preparing for exam or who are suddenly bereaved, and then what happens next? Their period ceases. So extreme stress will also be responsible for amenorrhea. There's a disease process called premature menopause. Premature menopause means the woman achieves menopause before the age of 50. Any woman that her period stops and has achieved menopause less than the age of 40 is termed premature menopause. And sometimes it could be a genetic problem. There are some genetic disorders like Turner syndrome that results in amenorrhea. So that's amenorrhea. Then we have what we call oligomenorrhea. Oligomenorrhea means infrequent menstruation. Most of the causes of amenorrhea are also the cause of oligomenorrhea. But the commonest cause again is polycystic ovarian syndrome. Then we have dysmenorrhea. Dysmenorrhea means painful period. Dysmenorrhea can be divided into two parts again. We have what we call primary dysmenorrhea, and we also have what we call secondary dysmenorrhea. Secondary dysmenorrhea means that the menstrual pain is due to something else. Things like endometriosis, things like pelvic infection, things like fibroids or polyps inside the uterus can cause what we call secondary dysmenorrhea. But in the majority of women that have dysmenorrhea, which could be as high as 40%, their dysmenorrhea is due to primary dysmenorrhea. That is, you can't find the cause. All they know is a few days before their period, they start having menstrual pain. And the pain usually starts in the lower abdomen. Sometimes it radiates to their back, and in the majority of them goes to their upper thigh. It's the kind of pain that starts like a few days before the period and goes on like 2 days into the period, and it can be very distressing. The challenge every time a woman complains of dysmenorrhea is to be able to differentiate between primary dysmenorrhea or secondary dysmenorrhea. The other menstrual disorder that we're going to talk about is menorrhagia. Menorrhagia means excessive menstrual flow. What do we mean by excessive menstrual flow? When you realize that you have to use more than double the amount of menstrual pad and tampon during the menstrual cycle, it is very likely to have menorrhagia. If you are seeing a lot of clots in your menstruation, it is very likely that there is excessive.
So the last of the menstrual problems that we'll be talking about is called premenstrual syndrome. Now, this is a type of syndrome that a lot of women complain about. And what happens in this is they have all sort of symptoms prior to their period. And typically, the symptoms disappear immediately the period starts. It's been estimated that there are over 150 symptoms, both physical and emotional that occurs in women who have premenstrual syndrome. Some of the common symptoms they have are things like breast tenderness, feeling of bloatedness. Some people are irritable. Some have what we call insomnia, that is inability to sleep, and all sorts of symptoms. But the funny thing is, immediately the period starts, all the symptoms disappear, and we call that premenstrual syndrome. Nobody knows what causes it, but it's been postulated that it's caused by the changes in the hormone in the woman. So we've talked about these 5 types of menstrual problems. We've talked about amenorrhea, which means absent period. We've talked about oligomenorrhea, which means infrequent period. We've talked about dysmenorrhea, which means painful period. We've talked about menorrhagia, which is excessive period. And we've also talked about premenstrual syndrome. So how do we treat them? Obviously, the treatment depends on what causes the menstrual disorder. If it is a situation of amenorrhea, it is important to know what is causing it. Like we said, amenorrhea could be primary, it could be secondary. If it's a primary dysmenorrhea, amenorrhea, that is a girl 16 years old has not seen her period, then she needs to see the gynecologist, who will do quite a few tests to try and find out why her period has not started. If it is a situation of amenorrhea, secondary amenorrhea, treatment again needs to be done and investigations need to be performed. We need to be sure it's not a situation of being pregnant. You need to do some hormonal tests. You check the LH, the FSH, the prolactin, and the estrogen level. We also do an ultrasound scan to check the inside of the womb to see whether there's anything in there that is causing the amenorrhea. In menorrhagia, the commonest cause of that in our environment are either a dysfunctional bleeding or fibroid. An ultrasound scan should be able to tell you which is which. And if it's a premenstrual syndrome, lifestyle changes, losing weight, going through stress management, some people say even acupuncture helps them. Exercises also helps. Thank you so much for watching this short episode on menstrual problem. Kindly subscribe to our YouTube page. You can like, you can comment, and you can share. And don't forget to buy the book. It's on Amazon. It's called How to Get Pregnant and Have a Baby. You can also get it on our website, www.stives.healthcare.com.